Thank you very much for inviting us to present on the topics of managing uncertainty about liver cancer and supportive oncology services. Prior to the diagnosis, after the diagnosis, during treatment, and during remission and survivorship, you receive a significant amount of information about liver cancer, treatment options, and also the genetic risk for liver cancer diagnosis for your family members. And you also receive a lot of information about the realities of life with and after liver cancer. Over time, medical providers and researchers, we found that there's some common themes regarding this depth of medical information that's really hard to interpret, can be confusing at times, and it leads to an emotional state of uncertainty. Most of the relevant research out there concerning uncertainty has focused on other types of cancer or liver disease. But it seems that the concepts of uncertainty are applicable to liver cancer and most life-threatening diseases. Uncertainty is rooted in ambiguity, vagueness, unpredictability, and incomplete information. Not being able to manage your uncertainty increases your risk for cancer-related emotional distress and other significant mental health issues. And so because of that, we'll discuss how to identify uncertainty and also how to manage it. We'll also discuss how to identify your emotional and physical support needs, and then also how to identify cancer center services and providers that can support those needs. I'd also like to acknowledge that my discussion today incorporates research from Donald Bailey Jr., Jia Yao, King Yang, Barbara Kimball, Kirsty Boyd, Marilyn Kendall, John Iredale, Scott Murray, Elizabeth Cohn-Stuntz, and Marsha Linehan. So we found that there's some predictable sources of uncertainty for you and for your family members as you are living and being treated for liver cancer. Having little knowledge about liver cancer before the diagnosis can lead to a sense of uncertainty. And you're not alone in feeling this way because it really reflects the general lack of knowledge and discussion about liver cancer in our society. And then the vague and unpredictable nature of liver cancer can also lead to a sense of uncertainty. And then there's some uncertainty also when you're trying to determine whether the symptoms or pains that you're feeling are related to liver cancer or related to another medical condition. And then you may also experience some uncertainty regarding whether you can manage those symptoms at home. Some of those symptoms might also include nausea or fatigue. And then sometimes you may also feel uncertain about feeling better on some days versus others. The other predictable sources of uncertainty for you and your family members include the extensive, complex, and frequently changing medical regimens for treatment, and then also maybe differing messages from healthcare providers. Difficulty understanding the purpose for your treatment, whether it's helping, and then also some difficulty navigating the healthcare system can also lead to a sense of uncertainty. And then you may also feel uncertain about how to plan for your future, how to manage some of the financial pressures associated with care, and then also managing the change in your level of independence with activities of daily living. And then there may also be some concerns about how others will perceive your diagnosis and maybe some uncertainty about feeling stigmatized as well. Now that we've reviewed some of the common sources of uncertainty, we'll move on to discuss how you can manage uncertainty and prevent emotional distress associated with uncertainty. There are two pathways for managing uncertainty, and that's reframing or changing the way you think about feeling uncertain about living with liver cancer. And then there's also problem solving. Changing your thoughts involves accepting your uncertainty and considering your concerns from a positive point of view. And then problem solving is your ability to identify and define what your concerns are and then find solutions. Reframing or changing the way you think about living with liver cancer involves acknowledging and accepting the experience of living with liver cancer. It's not black and white. And you can think and you can feel two different ways. That means that you can live with feeling uncertain, but still focus most of your energy and efforts on your sense of hope as you move forward with recommended treatments and put faith in your medical provider's expert opinions and their commitment to your care. Reframing also involves rethinking events related to liver cancer and talking about your experience with friends and family. That provides you with an opportunity to process your concerns, renew your sense of hope, and begin to problem solve. Some problem solving strategies include considering which aspects of diagnosis, treatment, or remission you or your family members have questions about, and then presenting those questions to your oncologist or a member of their team, such as the physician assistant, the nurse practitioner, or maybe even the registered nurse. Doing so may lead you to feel empowered. And then also determining which physical or emotional symptoms are affecting your quality of life and then seeking support from members of your team is also helpful problem solving. And it's common to feel unfamiliar with the types of support that are available at the cancer center where you receive care. And so I'll review some of the common members of the supportive oncology team and discuss how they may be able to support you. Palliative care providers, sometimes those are physicians, nurse practitioners, or physician assistants, they focus on relieving your pain or other symptoms such as constipation, diarrhea, fatigue, loss of appetite, nausea, vomiting, and shortness of breath. Palliative care providers can also assist you to consider your wishes in the event that you may need end-of-life care, including who you may desire to make decisions for you if you're not able to. Dietitians provide diet education. They can counsel you about meeting your nutritional needs and also assist you with assessing how to change your diet if you experience difficulty chewing or swallowing, low appetite, dry mouth, experience significant weight loss, or if you have a feeding tube. Physical therapists, occupational therapists, and physical medicine and rehabilitation physicians help you maintain your muscle strength. Perhaps, before surgery or after surgery, they help you to maintain your independence and improve your quality of life when you're living with physical weakness, fatigue, discomfort related to nerve pain or numbness or tingling sensations, difficulty walking, or difficulty dressing and caring for yourself. Social workers provide mental health assessment and counseling. They can also refer you to other resources such as cancer support groups, community-based resources, and they can also provide information regarding financial assistance programs, in-home assistance, and information about disability or public benefits. They may also help with coordinating transportation or even lodging if you're traveling a significant distance for cancer care. Acupuncturists apply very thin needles to specific points on your body for between 10 to 30 minutes to stimulate your nervous system in a way that promotes health and well-being. Acupuncture can treat common conditions associated with cancer and cancer treatment, such as pain, anxiety, depression, insomnia, and they can also reduce some of the common side effects of cancer treatment, such as neuropathy, nausea, stress, hot flashes, and fatigue. A cancer diagnosis or the course of cancer treatment may cause you or your loved ones to question your spirituality or experience other challenges related to your religion or your faith that you practice. And so chaplains are members of the supportive oncology team who support you as you process questions about your faith or religion or spirituality, which may arise during your care. Next, Dr. Kaplan will join us to discuss identifying when your emotions or behaviors are a sign of significant depression, significant anxiety, or a significant response to trauma, which requires support from a psychologist or a psychiatric provider, such as a psychiatrist, a psychiatric nurse practitioner, or a psychiatric physician assistant.
Thank you, Dr. Altidor, for that introduction, and thank you to the American Liver Foundation for inviting us to join your very important conference today. I think as Dr. Altidor described there in great detail, and as Mr. Romero and Mr. Ellis shared their own personal stories, there can be a lot of uncertainty and distress with a new diagnosis of cancer, going through the treatments, as well as the process of transplant, if that's what's appropriate part of your your care for your liver cancer as well. A certain amount of that distress is expected and it's normal. Common symptoms are what Dr. Altidor described, and in addition to that, there can be a lot of fear, sadness, sometimes anger, irritability, grief over a diagnosis, and denial of a diagnosis, sometimes feeling like it's too overwhelming to confront the reality of the diagnosis and pursue treatment from there. When these symptoms become excessive or they start interfering with your functioning, we're often thinking about ways that we can intervene to support you so that you can really engage with your treatment team and your care to get the best possible outcome. It's important to recognize that up to 25% of patients after receiving a cancer diagnosis or needing a transplant will go on to develop clinically significant depression. Similarly, 20% of patients will have clinically significant anxiety. And for many, although the diagnosis can be traumatic initially, up to 15% of patients are going to develop symptoms that are consistent with post-traumatic stress disorder and are going to need clinical attention to make sure that those symptoms can be controlled and managed. I want to describe some common mental health symptoms that people may experience, and when we begin to get worried that this is reaching the level where we should seek specific treatment around these syndromes and symptoms. When we think about depression, clinically significant depression, it's more than just feeling sad. It's a persistent sadness, feeling very down and blue, a persistent low mood that lasts for days and days, often weeks on end. And again, is interfering with your functioning, whether it's in your daily life or your ability to engage in your cancer treatment. People may have significant loss of interest in their pleasurable activities or lose the ability to experience joy when they're engaging in activities that they normally would enjoy. They may be frequently tearful and have crying spells. They may begin to avoid social interactions and pull away from important social supports. They can feel inappropriate feelings of guilt or grief or hopelessness. Things won't get better, or I somehow deserve this. And that can be very destructive for mental health. They can have low self-esteem, feelings of worthlessness, also lose their sense of motivation, whether it's for their own self-care, for participating in their daily activities, or for participating as part of the member of their own cancer treatment team. They can be experiencing low motivation and low energy. Significant sleep disturbances, often insomnia, but sometimes it's excessive sleep, sleeping 10, 12, 14 hours a day. And in the most severe and emergency situation, sometimes people can develop suicidal thinking, whether it's maybe I'd rather not be alive or active thoughts of harming yourself. And those are huge red flags to seek care. And because those are treatable symptoms and we want to get those under control. So again, you can have a higher quality of life and engage in your treatment. When we're thinking about anxiety, it's more than the standard worry of, this is a very scary diagnosis and I don't know what to expect. It's really that pervasive, persistent worry. It's invading all aspects of your day and your life, leading to really significant worry in multiple domains, not just cancer, but perhaps this financial worry. It's worry about health. It's worry about my family members and how they're going to do with this news or with this treatment process. The worry is often very difficult to control. People can feel very easily overwhelmed, and that feeling of overwhelmed can sometimes lead to avoidance of necessary care and treatments. Patients can become very irritable, very anxious. They can lack patience with those around them. They can feel very easily fatigued as part of feeling overwhelmed. They can also have physical symptoms, significant muscle tension, difficulty relaxing, feeling like you can't sit still. Again, sleep disturbance related to the worry and the rumination in regards to any aspect of your life, or specifically related to your cancer or your transplant. And in the significant, severe situations, people can experience panic attacks, physical symptoms, often feeling racing heart, difficulty breathing, a sense like you're choking or you're getting very sweaty or lightheaded or faint, often accompanied by thoughts of overwhelming doom and dread for the moment. And as we're talking about trauma, some of these symptoms will overlap with anxiety and depression, but any point of the cancer journey can be traumatic for somebody. Point of diagnosis, undergoing tests, undergoing treatment, undergoing the liver transplant evaluation, getting into survivorship. Heaven forbid there's a recurrence of the cancer or cancer spread. Those are all situations that can be accompanied with a traumatic response. And trauma frequently presents itself with these frequent intrusive memories and thoughts of these moments in our life that were very distressing. People can have elevated anxiety or mood changes when they're confronted with these thoughts or confronted with any situation that reminds them of that. Sometimes being in the clinical environment itself can be very traumatic and stress-inducing. Sometimes in the extremes, people will avoid going to the hospital, going to their appointments, going for their scans and their treatments because the feeling of anxiety or mood change is so overwhelming for them. Often people can feel on edge, waiting for the next bad thing to happen, waiting, when am I going to hear the next amount of bad news, even if all signs are good and the treatment is going well. Some people may have emotional blunting, this real difficult time experiencing positive emotions, or angry outbursts, or again, feeling very irritable. It's important to think about yourself as you're approaching this cancer journey and think about your own risk factors for severe mental health symptoms. Anyone who has pre-existing depression or pre-existing anxiety, which again are pretty common in the general population, is going to be at greater risk for these level of symptoms and distress. Similarly, anyone who's had difficulties with substance use disorders is going to be at greater risk. When we think about the staging of the cancer, often advanced cancer staging and disease is going to be accompanied with more distress and is going to be a greater risk factor for these symptoms. And then, as Dr. Altidor was describing some of the symptoms that can arise with cancer, a lot of these physical symptoms, pain, fatigue, nausea, vomiting, diarrhea, insomnia, weight loss, all of those can be very distressing and lead to clinically significant depression or anxiety. And lastly, as you know, our two patients eloquently described their experience with their social situations, experiencing any instability in those social supports, financial toxicity, housing instability, food insecurity, any of those things place us at greater risk too. So knowing yourself, knowing your vulnerabilities, and accurately and quickly reporting those symptoms to your treatment team, it's going to be very important to getting access to the support that you need. So again, you can really engage in your cancer treatment and have a higher quality of life. What we're describing mental health providers that specifically focus on the symptoms, we're thinking of psychologists and other therapists, and then we're also thinking about psychiatrists. The role of the psychologist is providing brief psychotherapeutic interventions, sometimes very problem-solving and focused on specific areas of concern. Sometimes what patients need is a listening ear, somebody that's not their family member, where they can really express any thought or emotion in a very safe space. And for many people, that can be therapeutic in and of itself. We often think about focused therapy around other needs. How do I cope with pain? How can I approach sleep and insomnia or excessive sleep or loss of energy? What are some strategies and coping techniques that I can utilize to really approach some of these problems and have a sense of control in taking over for these symptoms that are interfering with my functioning? Psychologists can also provide specific other coping strategies, whether it's breathing techniques, mindfulness strategies, changing your thoughts and emotions around your experiences. It can help you navigate any stage of the disease from diagnosis to cure to recurrence to, heaven forbid, end of life situations. And they can help you cope and manage that as well. They can help you identify areas of need, prioritize your cancer treatment, while also managing these other aspects of your life that are ongoing, responsibilities to family, work responsibilities. And then in certain situations, when appropriate, they can provide that long-term therapeutic support for folks who have higher levels of depression and anxiety that are going to need that consistent intervention. And then as we're getting to the psychiatrists provide a lot of those supportive psychotherapeutic techniques in their appointments with patients, but predominantly they're going to be focusing on medication interventions. When symptoms are moderate or severe, often medication is going to be very helpful and necessary to overcome those symptoms. And the psychiatrist's role in that is identifying the appropriate medication at the appropriate time. And when I say psychiatrist, again, it can be a physician, it can be a physician's assistant, it can be a nurse practitioner. All these folks are going to be qualified with the appropriate training to provide this level of service. Some examples of medications sometimes are just as needed. I get very anxious before a scan. I get very anxious before appointments or tests. Is there a medication I can take at a low dose that's going to relieve that distress so that I can get through that experience? Or is there a short-term sleep aid that I can use because I'm really having a difficult time falling asleep? Are there alternative pain management strategies, things I can do to manage my fatigue with medication? And then other supports for if I'm having cognitive symptoms related to my treatments. Some situations are going to require daily medication. Again, when that depression, that anxiety, that trauma response is severe and interfering with my functioning, daily medication can often really relieve those symptoms and give me back that sense of control in my own life. It's important to remember that these medications are often very safe, very well tolerated. They're prescribed to millions of people in our country every day, and people take them and really see significant improvement. But there's a high percentage of people that may not respond fully to that first medication. So it's important that you have that open communication with your treatment team. Let them know what's working, what's not working. They can make adjustments for you or change medications to really target these symptoms and get them under control as quickly as possible. It's important to remember that engaging in this sort of treatment not only will improve your quality of life, but also plays a significant role in your ability to adhere to your treatment and really get you the best outcome possible in relation to your cancer and your goals. It's important to consult with your psychiatrist or your psychiatric nurse practitioner or your physician's assistant to pick specific medications that are going to be safe for you in regards to your liver function and the other medications and treatments that are required as part of your care. We want to avoid those drug-drug interactions that are actually going to make some treatment less effective and avoid toxicities related to treatments. We also want to be paying attention to the level of function with your liver. Some folks get this cancer diagnosed at a very early stage. A lot of their liver function is preserved, and they can take really any medication that's offered to them. But for folks who get it diagnosed later, maybe there's been a significant amount of liver damage. We want to be very mindful about the medications that we're choosing, again, to avoid any potential toxicity. At any point in your care, keep that open line of communication, consult regularly with your treatment team, and make sure that you're taking medications that are safe and are helpful for you. So we can pause here again. Thank you so much for allowing us to join your conference today and just share some of these important concepts. And we are open to any questions or comments that anybody may have at this time. So thank you very much for your attention.
Thank you. This is a really, I think, under-stressed topic, particularly at my institution, where we may not have quite as big of a psychiatric and psychologic and just behavioral cognitive therapy team, at our disposal. So I think the key takeaway really from this, for me at least, and something that I would like to communicate to my patients and patients, who are dealing with this new scary diagnosis, is to not be afraid to admit that you're scared, right? I think it's important that everyone feels comfortable bringing that fear up, and addressing it. And the first step to that is really bringing it to someone's attention. And so we have a couple of questions over here. The first question is, does your team have you see a counselor? Maybe is that built into your cancer care?
Yeah, I think that's a great question. Oftentimes, there's going to be somebody within your cancer center, and especially if you've progressed to the point of the transplant process where you're going to be meeting with at least a social worker, sometimes a psychologist, and sometimes a psychiatrist. So often it's embedded at certain points in the care. But I think after the initial diagnosis, there's so many moving pieces that sometimes this aspect can get lost. And it's important, as you're saying, Michelle, just to raise that, that concern up the bat. I am having this significant distress or this fear or any of these range of emotions that we've talked about today, and make it front and center. So then not only can your hepatologist or your oncologist be treating what they are specializing in, but then they have that in the back of their mind. I can place that referral, that member of our team, or that person in the community who I know helps a lot of folks with these diagnoses. And they can do that right away to get you connected, because it may not be the first thing on top of mind. So I think sometimes it just depends on where you're at clinically and what needs you have. But raising those concerns early is really important, I think, to getting that connection if it's needed. And I just want to, again, normalize that a lot of these emotions and reactions are completely expected and normal. And it's actually surprising if somebody doesn't have some of this going on right when they receive the diagnosis, because these are completely normal human experiences and emotions. And so we want to be very sensitive to that too. We don't want to pathologize it, but at the same time, we want to recognize it and get the support you need so it doesn't get more severe.
Right, exactly. The next question is if insurance covers acupuncture.
Yeah, and Dr. Altidor, you can answer that, or I'm happy to as well.
So some insurances might. And then there are also acupuncturists out in the community that have a medical focus that can also accept private pay or insurance for acupuncture as well.
And I think the other important point is depending on the acupuncture provider, sometimes there's grant funds available too. I know every institution varies. We're very fortunate at Rush that sometimes that first or second visit is covered by either a grant or some philanthropic donations too. So just be aware of that and keep that in your mind that sometimes those resources for payment are available too. So always ask about that, and your social worker or your treatment team may know the answer to that at your local institution.
Yes, that's a great point. The next question is, do patients need additional pharmaceutical support if there's either weight gain or weight loss through the course of treatment? That's the first part of the question. And the second part is it considered natural and only mental support, or I'm not sure what they meant by the next portion. Anti-stress is offered to them. I think they're asking about the mode of therapy and what is there actually to be offered.
Sure. Maybe we can take that one each. Dr. Altidor, do you want to answer one of those questions? I'm happy to take the second one.
So we're always monitoring your weight and considering whether or not your psychiatric regimen does contribute to weight loss or weight gain. And so that's absolutely something that your provider will be monitoring, and you can also report during your appointment as well. And it's something that we can make adjustments based on. We can change your regimen based on that.
Yeah, and then modes of intervention, to get down to the specifics, sometimes if it's a psychotherapy approach, again, that's a psychologist, that's a social worker who's trained in therapy. They'll take many different approaches. Sometimes it's a single session, allowing you to feel heard, get those emotions that you had difficulty expressing to anybody else out into the open in a very safe space. Sometimes that level of support is enough. Sometimes there's those persistent symptoms, and you're going to meet multiple times with that person. Some of it's very structured and systems based, like you had mentioned earlier a few moments ago. Can be cognitive behavioral therapy, acceptance and commitment therapy. Those are two very effective, evidence-based, time-limited approaches to therapy. Sometimes it's more long-term supportive therapy, again, being that listening ear, providing practical interventions and problem-solving strategies. And then from the medication aspect, it can be very specific to a single symptom, or can help provide daily medication to provide for a whole range of symptoms that you're experiencing and really getting that distress under control. In terms of natural approaches to this, time in and of itself can be a natural healer. Receiving more information about what this process is going to look like, what the expectations are, can be a healer as well. We don't often recommend taking natural medicines or herbal medicines for a few different reasons. Often they're going to interfere or interact with the treatments that you're receiving for cancer. So be very cautious. Always be asking your pharmacist, your oncologist, your hepatologist if it's going to be safe to do something like that. And specifically, some of the natural medicines around mental health carry a lot of those interactions. So you want to be very cautious and mindful of those risks. There's also a quality control concern. Now, there are very high quality natural and herbal medicines out there from trusted sources. Unfortunately, many of them are not, and it's very dysregulated. So I just want to offer a tremendous amount of caution around that too, if you're going to go that route. Make sure everybody's aware of what you're doing, why you're doing it, and make sure that it's going to be safe. And then the rest of the interventions that we offer are pharmaceutical based, evidence based, scientific in nature. And we can at least be assured that the quality is coming from a pharmaceutical company, so we can be very reasonably certain that you're getting what you're being prescribed, which can be very different from that natural approach to some of these symptoms.
Right. Any particular thoughts or suggestions for patients dealing with metastatic disease and or also immunotherapy?
Yeah,
So
absolutely. So Dr. Alter, go ahead, please.
Sure. I was just going to say, definitely take some time to identify what your needs and concerns are. Once you kind of have that first step, you can determine what sorts of resources that you might be interested in. Sometimes it's just the uncertainty of kind of just, metastatic, what exactly does that mean for the course of my treatment? How might things change? Sometimes you need more information concerning the medical aspect of care. And then also taking a look at the emotional side, if you're, feeling any sort of spiritual concerns, existential, like kind of just what does this mean for the meaning of my life or anything of that nature, we have that support from the chaplains, as I mentioned earlier. And then also psychologists as well can help you to cope with a metastatic disease progression and to determine just what other resources might be helpful for you.
Important thing to keep in mind too with metastatic disease, which I'm sure has been discussed at other portions of the presentations today, but metastatic disease can mean many different things. In the worst case scenario, it's very advanced, and then we're rapidly preparing for palliative care situations and how to approach, the final months or perhaps years of my life. And other metastatic disease situations can be living with a chronic disease over many years. You've brought up this concept of immunotherapy, which has been a boon for cancer treatment in general, right? It's allowing people to live much longer, converting cancer to a chronic disease scenario. And then it's how do I live with what's a very serious chronic disease that may progress over the long term, but in the short term is not immediately threatening my life. But you will have different levels of distress, reasonably so, depending on what is meant by that metastatic disease process. There can be certain concerns with immunotherapies as well in terms of neurologic symptoms or psychiatric symptoms that can arise. I just again want to stress the importance of if you're noticing anything at all that seems off, I started this new immunotherapy, suddenly I'm experiencing this symptom, whether it's physical, whether it's emotional, I'm more anxious, I'm really fatigued, I'm becoming depressed, not thinking as clearly, having trouble remembering things, having trouble concentrating, those sorts of things unfortunately can come along with immunotherapies. So just bring it to the attention right away. Earlier intervention, or even maybe modifying the immunotherapy might be all that's needed. Or it might be, hey, is going to be a trade-off, but why don't you meet with the psychiatrist or the psychiatric advanced practice provider to talk about ways to mitigate some of those symptoms and get those under control so you can tolerate this life-extending therapy.
Absolutely. There are a few more questions, but unfortunately we've run out of time. So if you two don't mind going to the Q&A section and maybe typing in your answers, we would greatly appreciate that.